Regional resilience refers to the ability of a region to withstand, adapt to, and reorganize production and trade relationships in response to major external shocks.
Health security and resilience is to allow or to enable different countries in their own domains to have systems that are efficient, that are able to adapt and adjust to crisis as agile as they can, and to be able to have that connectivity, right, among systems within the states and across the states.
I think the first thing that ASEAN has to contend with is to accept the fact that not everyone views digital in the same way.
Good morning and welcome to this podcast on Reimagining Regional Resilience in ASEAN. My name is Denis and I'm a Senior Research Fellow at the Center on Asia and Globalisation, Kuan School of Public Policy. Resilience has become a familiar term in recent years, especially after COVID-19, supply chain disruptions, rising geopolitical tensions, and rapid technological change. But today, resilience is no longer just about recovery. It is about how countries and regions adapt and rethink how they operate in a more uncertain and fragmented world. For ASEAN, this challenge is particularly complex. Resilience looks different across emerging technologies, global value chains, and health and other non-traditional security issues. And policy choices in one area can create vulnerabilities in another. Today, we will explore what resilience really means for ASEAN and what it will take for the region to remain competitive, resilient, and secure. I'm delighted to be joined by Associate Professor Chang from the Singapore Management University, Associate Dean, Research and Industry Engagement, Director of the ASEAN Center for Research and International Trade, whose research focuses on global value chains and international trade. Our second speaker is Dr. Miguel, my colleague. He's also a Senior Research Fellow at the Center on Asia and Globalisation, the Kuan School of Public Policy, whose research focuses on the geopolitics of emerging technologies and artificial intelligence. Our third speaker is Professor Mely, Associate Dean, International Engagement, and Head of the Center for Non-Traditional Security Studies at the Rajaratnam School of International Studies at NTU, who is a leading expert on health security and non-traditional security studies in the region. So let me begin by asking each of you a broad, same question. So from your perspective and expertise, when we talk about reimagining regional resilience, what does that mean to you, and why is it so important within the context of Southeast Asia? Let me start with Pauli.
From my perspective as an international trade economist working on global value chain, regional resilience refers to the ability of a region to withstand, adapt to, and reorganize production and trade relationships in response to major external shocks without excessive disruptions to income and long-term growth. This rethink is especially important for ASEAN today as it sits at the intersection of multiple overlapping shocks. For ASEAN economies that remain deeply embedded in global value chains, the central question is not whether to integrate, but how to integrate that preserve openness while reducing exposures to concentrated risks. Understanding regional resilience in this economic network-based sense is therefore crucial for designing policies that preserve and support both competitiveness and stability in the current environment.
Thanks, Pauli. So Miguel, what does it mean to you?
Well, I think for me, especially in the context of both technology as a strategic enabler for the region, I believe that the question really is not broadly what regional resilience or resilience is in general, but rather what resilience means for each of the particular members of ASEAN. And especially within the context of digital technology, the fact that you have varying levels of development across the different regional states would suggest that their perspective of resilience can actually either correspond or be misaligned with one another, which then raises the big question of if these alignments are non-existent or are sparse, how do we actually come up with a unified version of regional resilience? So in my perspective, is a two-step process. First, figure out what resilience means for the different regional states, and then figure out whether there are points of cooperation, collaboration that allows them to bridge potential differences. And it's only once you do that, then we can start talking about regional resilience, at least within the digital perspective, in this larger cohesive sense.
Thanks, Miguel. Mely, what's your perspective on this?
From the perspective of health security, you can draw the very close relationship between what it means to be secure and what it means to be resilient. In the context of health security, it's to be able to first to detect and to prevent and to respond to health issues, particularly those that actually impact heavily on or severely on the health and security of individuals, communities, and states. So if you're able to prevent things like pandemics, detect them, and to respond immediately, then you would think that you're secure. But health crises, if you think about it as a polycrisis, that it actually can spawn other crises. COVID pandemic is a very good example. It was not only a health crisis. Soon after, it escalated to become an economic crisis of global proportion, worse than the 1930s, similar to the 1930s economic recession. So if you and then its impact on, employment, on food security, etc., then you need to be able to see health as a part of a bigger component of other elements, right? You cannot have a siloed approach to health security, economic security. So they all have to be seen as an integrated, interrelated issues. And when you then move into the concept of resilience, you must then to say, well, resilience could be, as you say, ability to, again, prevent, to be able to endure and recover with dignity. You're not able to do that unless you see the interconnectedness of all these issues, particularly when it comes to systems response. Yeah. So health security and resilience is to allow or to enable different countries in their own domains to have systems that are efficient, that are able to adapt and adjust to crisis as agile as they can, and to be able to have that connectivity, right, among systems within the states and across the states, so that it can be a regional response. Yeah, so to me, regional resilience in health could mean the ability of different systems within a region at the national level, at the sub-regional level, to be able to connect. There has to be improved connectivity and interoperability of systems so that they can, as broadly defined, health resilience to be, or regional resilience to be able to adapt quickly, to respond quickly, and to be able to recover, right, with dignity.
Thanks, Mely. Let's drill down a bit more. Pauli, with pandemics, trade wars, and geopolitical tensions becoming more frequent, what lessons can Southeast Asia draw from past disruptions to prepare for the next one?
One big lesson is that firms and economies that have options such as multiple supplier flexible logistics and regional production links recover faster. During the US-China trade tensions and the pandemic, we saw production shift within Southeast Asia instead of returning to the advanced economies. This suggests that resilience is less about reshoring or decoupling, but more about strategic rebalancing within the global and regional production network. For small open economies, blanket reshoring and duplicating entire supply chains is often costly and ineffective. What tends to work better is targeted diversification at specific bottlenecks, so that disruptions in one location doesn't hold the entire chain. Similarly, in logistics, improving redundancies at key ports and customs nodes can enhance resilience without replicating the whole transport networks. These targeted strategies preserve scale and efficiency while reducing vulnerability, making them far more practical than broad economy-wide reshoring efforts.
Thanks, Pauli. Miguel, AI-enabled crisis decision support is spreading fast, but how do we make it resilience-enhancing rather than a new single point of failure?
So I think the question here is not whether it will become a single point of failure, but how do you actually use these decision support tools or decision aids appropriately? So it's not surprising that AI features heavily when it comes to these types of crises, mainly because these tools allow us to circumvent or to complement existing issues with regards to human decision making. So the critique has always been humans are slower, biased, emotional, and with this in mind, AI does provide some leverage that allows us to make more objective decisions when it comes to crisis situations. The problem, though, is that you also have to look at the inherent limitations of artificial intelligence. And we look at this through two key dimensions. First is the quality of data that we have, and the other is the difficulty of the task or the judgment that you're expecting from AI. So if we expect that the judgment task is relatively easy, you have quality data, then there's no problem offloading everything to artificial intelligence. So in tasks such as logistics, for instance, where you know what you need, when you need it, and where you need it, then that's not a problem. You can easily deploy AI tools for those types of tasks. The problem, though, happens when, in the case of a disaster, for instance, when you have a lot of uncertainties, the availability of past data to train the model on is questionable. Then we run into the inherent limitations of artificial intelligence. You can have situations where the AI does perform well, but only under very narrow conditions. In that case, if the situation that it's eventually applied to does not neatly match what it was trained on, then AI becomes quite brittle and unpredictable. So it becomes a trade-off essentially, understanding when AI as a tool can best support the decision maker during these periods. So it's a matter of figuring out the judicious use of these novel technologies in order to aid us to become more resilient. And if we fail to do that, then we basically add another issue that we need to deal with on top of other issues that are already problematic.
All right, thanks, Miguel. So, Mely, the COVID-19 pandemic really changed how we think about health risk. From your perspective, how should health security be rethought as a broader regional resilience strategy rather than a standalone issue?
I think what COVID-19 has shown, or perhaps COVID-19 is what we call a definitive proof of concept of a polycrisis, right? So when you look at that as an issue or a problem that generates multiple crises, you cannot afford to look at a problem in its in a siloed way, right? So when you respond to a crisis like this, or when you anticipate the emergence of another pandemic, for example, because now after the lessons of COVID has taught us that it's a matter of time. It's not if, but when the next pandemic is going to come. So everybody is now trying to prepare for disease X. But in doing so, it allows you to be more anticipatory in the kind of issues that come first when it comes to surveillance of diseases, for example. I mentioned earlier about the need to ensure that your systems are in place, and that requires systems for information sharing, detection and information sharing. And when you talk about information sharing to prepare for a pandemic, you then link it to what is available, or you want to examine the current infrastructure and technology, for example. So when it comes to resilience in terms of digital resilience, you look at the ability of the systems to actually have credible information to avoid problems of misinformation, so that countries or communities that are affected will not be hesitant in sharing this information. And then when you talk about integrating it, not just with your technology, but even down to your economic planning, what needs to be done? COVID-19 has shown us how devastating a pandemic is, right? It's not just the loss of lives, but it stops business, stops employment. So how do you pandemic-proof your economy, right? And especially since, as what COVID has taught us, health crises like this are really transnational in nature. You cannot afford to look at it from a national perspective. Your responses cannot be national. You have to be you have to be effective in your national response, but how the others respond, other countries respond, is also very critical. Hence, at a regional perspective, you need to be able to encourage not just the information sharing, the technology, but also expertise. You have to be able to get resources, source for these resources, and coordinate how these resources are going to be distributed. And to be able to do that, you also need to emphasize, right, or re-emphasize the importance of cooperation and regional trust. So when you look at the health crisis and its relationship with the other crises, polycrises that could emerge in a hyper-connected world, right, it's very important to look at existing institutions, the norms that define it, because this then defines the relationship of different agencies, governments to work effectively, so that it's not just the response during the crisis, right, but to enable the system to be more resilient. I mentioned earlier the need to be able to learn. There has to be a transformative element to resilience. That's why we talk about reimagining it, because what we learned in the past should then be able to tell us that we have to get these systems ready. We have to have these norms of cooperation, which includes, amongst others, transparency. And if you don't have trust, right, among different agencies, among different countries, then you cannot have this, these goals of disease surveillance, immediate response, etc. And you're not able to encourage a multi-sectoral and a multilateral approach to this, particularly in an environment that is, also challenged by geopolitical tensions. We saw how COVID became a victim of geopolitical rivalries. So all of this, institutional norms, norms of cooperation, are part and parcel of an integrative approach to a health crisis. It's not just a medical crisis. It's a crisis that requires multi-sectoral responses.
Thanks, Mely. Let's move on to the next question, which is going to be a very broad strategic question, the same question I will ask all three of you. As we look ahead and taking into account the challenges we have discussed today, what is one or two priorities that ASEAN policymakers should really focus on if it's really serious about strengthening regional resilience? Let's start with Mely first.
Within the context of ASEAN, we have a lot of work plans out there that will give you an idea of the thinking of policymakers. So, as you know, ASEAN has come up with this Vision 2045, and it's anchored on three pillars: political, security, economic, and sociocultural. Now, within the context of health security, which I said earlier on must be seen as an integrated, interrelated issue that cuts across the political, the security, and the economics, one priority that I think policymakers should focus on is to see the extent to which existing mechanisms can be leveraged, can be optimized, so that if you're talking about an integrated multi-sectoral approach when it comes either to preventing the next economic crisis and its relationship to, for example, ensuring that your health systems are secure to get the right resources, or that you want to secure your global value chain, you have to be able to see what are the existing mechanisms out there. I talk about perhaps looking at living structures that ASEAN has and the existing networks, so that you can then map out, right, with all of your plans, what do you have as existing networks, existing institutions, and identify where are the weak points, right? The weakest chain, for example, and then focus your attention on that. And this is very pertinent in the context of health. Is it strengthening health systems, for example, at the national level, provide not just infrastructure, but providing the expertise and the resources, or ensuring that your health systems are connected to the wider systems? You're talking about technology, for example. Do they have access to all of this technological development? When it comes to expertise, how can AI, for example, help in strengthening disease surveillance and disease response, for example? So that's one. And when you're then able to identify where are the weakest points, and when I talk about an integrated approach, that will then strengthen regional resilience, because it has to be, when you talk about regional resilience, you are talking about the ability of individual ASEAN countries working together, right, to build that regional resilience. So how can you therefore create different nodes that will connect your health systems, your environmental systems, your social systems, and your economic systems, right? To then, to have a more transformative approach, if you like, to deal at their own specific domains, to deal and address the problems that affect them. And that is very pertinent in health, because as we saw in the case of COVID, it was not just the health systems, health sector working together. They had to coordinate with the economic sector when it comes to responses. They had to coordinate with the defense and security sector when it comes to preventing, looking at border controls, facilitating the movements of people. And then they have to coordinate with the foreign ministry so that they can arrange for, diplomatic arrangement when it comes to affected individuals and communities. So all of this, it's very hard to think about it. It's very ambitious to think about it in a more integrated way. But this is what the ASEAN Vision 2045 is all about, getting all the communities to work together, right? So that you can have not just a siloed approach, but a more comprehensive approach. And hence, hopefully, you're able to have a more reimagined, strengthened resilience.
Thanks, Mely. Miguel, what should ASEAN focus on?
Yeah, I think building on what Mely said earlier about these issues being interconnected, it's the same with the digital domain in this case. So digital taps into the political security dimension, into the economics, into the social as well. But the problem is that if we look at how ASEAN has looked at the question of digital, it seems to concentrate more often on the question of capacity and capability building, which is all well and good. That's fine. But the problem is that if we focus solely on that, there is this inherent assumption that everyone views digital technologies in much the same way. So this links back to my earlier point that everyone has different perspectives of what resilience actually means. And in the case of digital, this may be related to both their latent capabilities within this domain, as well as pre-existing economic or social processes that are leveraged using digital technologies. So I think the first thing that ASEAN has to contend with is to accept the fact that not everyone views digital in the same way. Not everyone has the same priorities when it comes to achieving resilience in the digital domain. And once you realize that, you can start figuring out what individual countries need and planning around that so that everyone integrates well with each other's systems. Now, I'm not calling for a ASEAN-wide digital network where everyone is on the same playing field. That's, I believe, overly aspirational. But at the very least, I think as the ASEAN leadership needs to acknowledge the fact that not everyone has the same view as everyone else. And that's fine. Okay, that's perfectly acceptable. But we need to plan along those lines of differences in order to try to have one unified approach towards the question of digital resilience.
Thanks, Miguel. Mely?
I think one clear priority is to build the foundations that allow firms to adjust quickly across borders, including trade facilitation, logistics, connectivity, and regulatory harmonizations. These are not headline-grabbing policies, but they matter enormously for resilience because they determine whether production can shift quickly across borders when shocks hit. At the ASEAN level, this means pushing harder on reducing custom frictions, harmonizing regulatory standards, and improving digital trade infrastructures so that firms can refigure supply chain quickly within the region more easily. ASEAN can play a central role by sharing information, aligning incentives, and reducing policy uncertainty that discourage firms from spreading activities across member states.
Thanks, Mely. The key takeaway from today is that resilience in Southeast Asia and ASEAN as a regional institution will increasingly be shaped by how well the region adapts its technology and value chain and health security strategies. We've seen from the discussions today that it's all very interconnected and cross-cutting in nature. Collaboration, policy alignment, and responsible innovation will be essential as challenges become more complex. Thanks to our panelists for their valuable insights, and thank you for listening to Policy Unpacked. See you next time.